Hi, everybody. Welcome back to Robert's English Classroom. I am Robert. This lesson is about how to talk about going to the doctor's office in English conversation. So let's take a look at the first step, which is make an appointment. So if you need to go see a doctor, you might have to make an appointment before you go. So you need to find a doctor you want to visit and then call or go online and set a time and a day. Now, of course, if it's an emergency, you won't do this. Maybe you just go to the hospital. But if it's not an emergency, you can use this way. Some doctor's offices let you walk in. I live in Taiwan, and you can walk into almost any doctor's clinic and just wait. But other times you need to set a time. In the USA, often you need to set a time with a doctor. So make an appointment. I have had a stomach ache for 3 days. I need to make an appointment with Dr. Lee. You need to make an appointment to see the eye doctor. Now, after you make an appointment, you can go to the doctor's office, and when you go, you usually sign in or check in. The doctor may ask you, or the front desk administration may ask you, do you have insurance to cover your visit? So insurance covers you. That means the insurance will pay for all of the doctor's fees or some of it. Some places have a registration fee. Like in Taiwan, you need to pay about $5 or $6 registration fee every time you go to the doctor. So each country could be different. So sign in or check in. When Julie signed in at the doctor's office, she needed to show her insurance card. She doesn't need to pay the registration fee because she is covered. And she is covered means the insurance will pay for everything. So after we check in, the secretary might say, please sit down and wait. And you wait in the waiting room. Very easy, right? It's a room where you wait. Some doctors might give you a number and say, okay, you are number 5, so you need to wait. And how long is the wait usually for you when you go to the doctors? Sometimes it could be 1 hour, sometimes 30 minutes. So you need to wait in the waiting room. Sometimes I need to wait in the doctor's waiting room for 1 hour. Ted likes to visit Dr. Mel because the waiting time is usually short. So how long is the waiting time for your doctor? Now, finally, you can go in and see the doctor. So the doctor will give you an interview. This is when the doctor checks you and asks you some questions about your problem. So the doctor may ask you, like, what are your symptoms? Symptoms. And the symptoms are the parts of your body that you feel are not comfortable or that hurt or that don't feel good. The doctor might also say, do you have any pain or discomfort? And discomfort is when you're not comfortable. So you can say, I have some discomfort in my stomach, or there's some pain in my back. Now, depending on what's wrong, the doctor may ask you to lie on the exam table. And the exam table is a table or bench in the office, and you can lie back and he can feel a part of your body that has discomfort. The doctor may ask you to cough. He might ask you to take a deep breath. Right? Again, depends on your discomfort. Please lay on the exam table and tell me your symptoms. Please cough. Do you feel any discomfort or pain? So after the doctor checks you, he might give you a diagnosis. And the doctor is giving you an opinion about what the problem is. So he may say, you have a fever, or you have a skin rash on your skin. Maybe you have an ulcer in your stomach. Maybe you have high blood pressure. So, of course, there are many diagnoses he can give if you have some pain or discomfort. But this is called the diagnosis. Dr. Smith's diagnosis was that Joe has high blood pressure. If you don't agree with the doctor's diagnosis, you can check with a different doctor. We call this a second opinion. The second opinion, that's when you might go to another doctor or even another doctor and listen to their diagnosis. Treatment. So the treatment is what you should do, what the doctor tells you to do. So the doctor may prescribe medication. That means the doctor tells you, I want you to take this medicine. Now, remember, in English, we don't say eat medicine. We take medicine. Take it. That means drink it or eat it. But we use take, not eat, not drink. You can take some tablets, little round tablets. You could take a pain reliever, which makes your pain go away. But if there's no medication and the doctor is not sure what's wrong with you, he might order tests. That means he wants to do some more tests to see what's wrong. This could be an X-ray. This could be an MRI to check your body out more carefully. It could be a blood test too. Dr. Wong wasn't sure about the diagnosis, so she ordered more tests. The doctor wants to make sure, so we'll order tests. Nate needs to take some medication every day for the next 4 weeks. So again, take medication or take medicine. Both are the same. Follow-up. Follow-up is when the doctor will see you again. So the doctor maybe will give you a diagnosis and give you some treatment. The doctor might also say, come back in 1 month for a follow-up examination. The doctor can check your progress. Are you getting better? Are you getting worse or no change? Sometimes the follow-up can be online, but sometimes you need to visit the doctor's office again. This is called the follow-up. Follow-up visit, follow-up exam. Stan had a follow-up visit with Dr. Willis to check his progress. Dr. Roach can do his follow-up meetings online with his patients. That's convenient. You don't need to go to the doctor's office. You can do it from your cell phone or your computer. And that's it. How to talk about going to the doctor's office in English. First, we make an appointment. Then we sign in or check in. Wait in the waiting room. The doctor will interview you and ask you some questions. And you can tell the doctor your symptoms. What's wrong with you? What do you feel? After, the doctor will give you a diagnosis, maybe. And then he will prescribe some treatment, maybe prescribe some medication, or if the doctor is not sure, he may order more tests for you. And finally, you might have a follow-up visit or a follow-up exam. The doctor can check your progress. Final quiz. Let me ask you, how often do you visit a doctor? I think for me, it's once or twice a year. Not a lot. And also for small things, luckily. And do you take medication? That means, do you take medicine every day or every week or every month? I don't. Okay? And that's it. Going to the doctor. Is this good? Do you have any more questions about this and visiting a doctor? Is this how you visit the doctor in your country? Anyhow, I hope you're healthy, and I'll see you in the next lesson. Bye-bye.